Cynthia, is there any evidence or any thoughts about what the method of delivery? So should a mother be delivering vaginally? Should she be delivering by C-section? What's your approach to that?
Yeah, in general, for any women with IBD, the only times where we usually recommend consideration for a cesarean section over vaginal delivery is if a mum has active perianal Crohn's disease, or if they've had extensive pelvic surgery such as a ilioanal pouch. So the vast majority of the time, we make the obstetricians make the decision about mode of delivery based on obstetrical considerations rather than gastroenterologic considerations. So again, to reiterate, unless a woman has active perianal disease or has an ilioanal pouch, the decision to deliver should be made by the obstetrician. And obviously there's other obstetric considerations. If the baby's head is too big and the baby gets stuck and the baby's coming up, feet first, those are obstetric considerations. In light of COVID, it is true that the majority of the babies that were delivered in China were delivered by cesarean section, but there may have been other reasons for that. It was not because I think they were initially uncertain whether there could be maternal to fetal transmission via the vaginal delivery, but as Anne has mentioned, all the sampling that's been done so far hasn't really demonstrated that that is a big issue at all. So at this point in time, we would say that the obstetricians do make the decision independent of the COVID and just take into account, number one, the IBD considerations, but more likely just the obstetric consideration.
And maybe you can both jump in on this question, but should women feel safe delivering in a hospital during a pandemic?
I would say yes. I mean, I'm sure it's no one's birth plan to deliver during a pandemic, but I mean, the hospitals have been preparing for this. I know at least in our institution, there are daily meetings to ensure the safety of the parents, the pregnant women, and the healthcare providers as well. However, obviously, there is going to be some changes that are noted when you come to the hospital. Most institutions have pretty clear restriction of visitors, for example, and screeners to ensure that no one comes into the hospital with any kind of symptom suggestive of a respiratory illness or fever. I think it's not a bad time, as much as the hospital is being prepared, also for the pregnant person to be prepared as well, in terms of she should have maybe some backup caregivers in case the designated partner would be or caregiver would be symptomatic at the time of the delivery. So just to have extra help as backup. But again, most institutions will not allow multiple visitors at the time of delivery. So there will be some change.
Mm-hmm. And I think the caveat from a clinic perspective is that our IBD patients know that we're trying to convert most of our in-clinic visits to telephone clinics from an IBD standpoint, but from an obstetric standpoint, that may be a little bit trickier. We have encouraged all our patients to speak to their obstetrician's office to see whether there are some appointments that can be converted to telehealth visits or just telephone clinics. But obviously, if there is a need for obstetrical ultrasound and the patient's advised to come in, then they should do so, because ultimately it is the health of the baby that's most important. And then, as Anne mentioned, whether it's in a hospital setting, a clinic setting, an infusion clinic setting, patients are being screened appropriately. Everyone is taking extra precautions. So please don't try and avoid coming in for scheduled visits if you have been asked to specifically turn up for that visit.
Yeah, it's a really important message. Yeah, it's a really important message.